Hello, good day, and welcome once again. Today, I want to thank us so much for subscribing to this channel. And I want to thank you, my returning viewers and my new viewers. Thank you so much. Just as I told us before, that on this channel we'll be discussing important health issues, the importance of exercise, and some other pressing issues in the environment. So today, I want to introduce us to a topic: the dangerous drugs that can make you or cause you to vomit blood. Sometimes in our environment, sometimes you'll be in the hospital, they'll bring in a patient, and then they'll say the patient has been vomiting blood, maybe over the last 1 hour or so. And then when you ask the relatives or anybody around or the person will say, they gave me poison. They gave me poison. So because he or she is vomiting blood. But I'm making this video so that you understand that there are some things that we do. There are some drugs that we take that can also make you to vomit blood. So I split this video or this topic discussion into different segments. Number one, what are the things that can make people to take drug that can make them to vomit blood? Then number two is what are those drugs that can make you to vomit blood? Number three, what happens when you take it for a long time? Those when you take them for a long time. And then the number fourth thing we are going to discuss is what are we going to do about them? What to do to prevent them? So now let's go down in details to discussing them. Number one thing is what are those things that can make you to take drugs? These drugs that can cause you to vomit blood, which after which they will say that they gave you poison or that you have eaten poison. We are not saying that there are no poisons. There are poisons, of course, but we are discussing about things that are common within this society or this part of the world. It shows world over. All right. So now, some people, when they have a headache, especially chronic headache, that is a headache that has been there for a long time, maybe 3 months, 6 months, they be having persistent headache. So as the thing is disturbing them, make I just use some ways that may be familiar with everybody. As things come, they disturb them for a long time. You understand? So they go to take pain medicine. As things come, they disturb them. So person go talk say the thing they disturb me, they disturb me. The pain they disturb me, they get pain, they get headache. So the person now be taking pain medicine to relieve the pain. Or some people they be having a chest pain. So they go talk say they get chest pain, so I go they take drug where they help me relieve the pain. Some of those drugs are going to discuss them in details. Then some other things that we also do in this part of the world and then world over is there is something they do after work, especially people that do some of these artisans, people that do daily work, like people that work, do builders, house building, and there's some other works. People that use barrow and some other things, they'll be having serious body pain when they come back. So they will take drug to reduce the pain, so that tomorrow they can go back to work. Do you understand? So these are some of the things. And then there are also the other class of people that may be having waist pain, knee pain. Say they get rheumatism, so they take this drug to reduce the pain. So because of the rheumatism why they get, because some call it rheumatism. You understand? So maybe because of osteoarthritis and some other things, they be taking the drugs. So these are some of the things that can make people to take pain medicine, pain relieving medicine, and then will cause them to start vomiting blood. Then they will say they have taken or they have eaten poison. So now, what are those drugs? The commonest one that we have in our environment, their group name, they are called NSAIDs. NSAID, non-steroidal anti-inflammatory drugs. NSAID. The commonest one that people normally take are the diclofenac, ibuprofen, piroxicam, and other ones. You understand? So these are some of the drugs that when you take them for a long time without caution and without good prescription, they can cause you to start vomiting blood. So what are the other drugs that can, if you also take for a long time, can also make you to vomit blood? There are many of them. There are other things that when you also do, they can cause you to also vomit blood. Like if you are taking alcohol. Alcohol is also a drug. So if you take it for a long time, it can affect your liver. You understand? It can also cause erosion of the stomach, and then you can start vomiting blood from there. You understand? Now, what happens when you take these drugs? What happens is that God has made our stomach to have coats, like the way you have paint, cement. You have cement. You now have painting that used to surround the wall of the house. Do you understand? So as God has made it such a way that our stomach has something that is coating it. Do you understand? So when you take these drugs, the NSAIDS, that is diclofenac, ibuprofen, piroxicam, alcohol, for a long time, they will go down. There are other biochemical processes are involved, which are beyond our discussion or this video. Do you understand? So they will go down into the lining that is inside the stomach, and then you reduce those things that used to protect the stomach. And from there, the person will now start having pain. Having pain for a long time. Then as the pain is coming, from there, it can start vomiting blood. And the pain will usually be a form of burning sensation, like say person they get a fire, they burn person, or it could be like say thing they pepper the person, and the pain they go back. Do you understand? Like they get pain, you'll be having pain here, that is upper here, and then the pain will be radiating or going towards the back. Before you know it, the person starts vomiting blood. So that is what happens. So it reduces that protection that God has given to man. Do you understand? Then after that, what can we do about it? What you should do is that when you have such all those things like a headache that has been there for a long time, you're having waist pain, or you have gone to work, you come back, you're having body pain, go and meet your doctor. Your doctor will write a drug for you, maybe write the pain medicine for you, and still write another drug that can help your stomach to remain the way it is. Do you understand? There's something that you must also know is that there are other drugs that can be used for pain. It is not only diclofenac, ibuprofen, and the piroxicam. There are other drugs that can also be used, and these are the things that a doctor, a medically trained personnel, will help you to sort out. Do you understand? So, but if you're in a place where you don't have access to a doctor or something like that, if you are taking those pain medicines, don't take them for a long time. They can damage your stomach and cause you to start vomiting blood. Do you understand? So meet a doctor, or if you're in a place that you don't take them for a long time, if you want to take them for a long time, maybe 1 week or so, use a drug that is called omeprazole. Omeprazole can help you. Some people can also use other drugs, but some of those drugs you may not use them in some people. For instance, in pregnant women, you cannot use some drugs that can also help to protect the stomach. Do you understand? So these are some of the things that I say let me lay bare so that people will get to know about these things. Do you understand? These are some of the things that can cause some of our people to start vomiting blood, and it's quite dangerous. Also, like it's very, very dangerous. It can kill. It kills. It kills. Not that it can kill. It kills. So I want to thank you so much, especially my returning viewers. I want to thank you. If you're a new viewer, please, I want you to subscribe to this channel and then share this video so that more people can get to know about what I'm discussing. Because this channel, as I promised us, health-related issues, especially the important ones, people will get to know it. That is my work. My job is to enlighten our public so that they will know that these are the things that are happening and how to get to the solution to that. Thank you so much for watching this video. Please hit on the subscribe button if you have not done that, and then like this video, possibly share it so that other people can also see this video. Thank you so much, and may God bless you. Thank you.